Hi, everyone. Welcome to the Harmony Foundation podcast series. And I'm pleased today to be joined with Elise Dubois with RiverMend Health. Welcome, Elise.
Thank you.
It's really great
to be here.
It's so great to have you up on campus here at Harmony. And we want to hear more about RiverMend Health. But before we do, we want to learn a little bit about you. What got you into the field of addiction treatment?
Well, I am from Detroit originally, and I was working in automotive marketing for about 13 years there. And was looking for a change from the corporate world. So I decided to get my master's in mental health. So I completed my master's in mental health in 2010, and then realized that I may not want to be a therapist. I had some personal experience with recovery and some professional interest in the field of recovery, decided to move to Los Angeles, and just became more invested in that field professionally.
I think it's quite a big shift to go from Detroit to LA.
Yes, it is.
And you like the sunshine, I guess.
I do. I love the sunshine. I hate the traffic.
Oh, yeah, there is a lot of that.
Yeah.
I guess it's like a what do you call it? A way versus, the pros and cons.
Yes, it's a give and take.
There
definitely.
You go. Yeah.
Definitely.
Well, so you work with RiverMend Health, and what I learned about it when I was doing my research is that RiverMend has a continuum of care model with various treatment programs that addresses residential IOP and even eating disorders, correct?
Correct.
And so can you share a little bit about how RiverMend assesses which program is best for a client when they call into your program?
Sure. So we do have eating disorder specific treatment programs, substance use disorder specific, and then each of our programs also has a kind of a niche within it. Mm-hmm. So Rosewood Centers for Eating Disorders is our eating disorder treatment program. Bluff Plantation is treating substance use disorder primary in Augusta, Georgia, and Positive Sobriety Institute is a professionals program in Chicago. So our calls are fielded by a sort of centralized intake group, and at that point we do an over-the-phone assessment. We can also run any financial information that a potential patient may be interested in learning more about, where they stand. And then at that point we decide which program would be the best fit. If it's within our family of programs, we also have a really, really large book of resources outside of our programs, and I would say that we probably refer out the majority of the calls because there's something that is a better fit either geographically, financially, or clinically. But we do a pretty thorough assessment over the phone, and then if someone is going to continue on to admit to one of our programs, we'll then do a deeper dive clinical assessment and really kind of continue assessing along the way. If a different say an eating disorder pops up as a primary at one of our substance use disorder treatment programs, we can address that and refer out if necessary, and then vice versa. Those two addictions sort of go hand in hand. So we're always looking to make sure that the patients are in the most appropriate level of care at the most appropriate program.
And do you all take insurance?
We do take insurance. We're in network at Rosewood, so eating disorders, and then out of network with our substance use disorder treatment programs.
Great, perfect. So that's always a big question that people ask, isn't it?
Yes.
So my experience in working with RiverMend is that you all have a very strong medical model.
Yes.
That can really treat some folks that are fairly highly medically acute, because we all know that this disease is not just about the physical addiction or the psychological addiction, but it's also about what it's done to the body. And so can you talk with us a little bit about how you all address the acute medical needs that come up when people admit into your program? And I'm assuming that would probably be more often at the Bluffs in Augusta.
Yes, so for the substance use disorder side of things, definitely Bluff Plantation is equipped to handle a variety of medical issues. So Dr. Jacobs, our medical director there, is also the admitting physician at the hospital, the local hospital. So can really help people get in to see neurologists, endocrinologists, work with patients who have diabetes or even chronic pain issues. So he's board certified pain management before he was board certified addiction. And so has a really deep knowledge of just different medical issues that can arise, and we can get those issues addressed pretty quickly. Our other program that probably deals with that the most is Rosewood. So with the eating disorders, as you can imagine, there are a myriad of medical complications that come along with that. One thing that Rosewood is able to do is to detox an eating disorder patient, which is a pretty rare resource to have. So along with that really heavily medically supervised detox with a medically compromised patient, we also look at, a vast array of medical issues that come along with eating disorders, and we're able to treat those safely, and have the ability to work with the eating disorder alongside the other medical issues.
And usually that just increases success rate post-treatment when you're able to take care of those medical issues, which often can be a trigger for relapse for many folks.
Exactly. Especially for the substance use disorder side, and the pain issues that may come along with that, opiate addiction and or chemical dependency on opiates. Definitely. And then for the eating disorder side of it, it's just a continuum of increased health that keeps somebody in recovery, on that side of things.
That's wonderful. So this is your first visit to Harmony.
Yes.
And I know that you haven't really been able to do the full tour yet, but what are your thoughts so far?
It's beautiful. Again, coming from Los Angeles, it's a big change, but I really value the seclusion here, I guess, if you will, and just the containment. And I think that for a lot of people, especially in early sobriety, the quiet is really good and really beneficial. And I can see that being a really big draw for people who need to get some space. And, I'm a nature lover, so I love the nature aspect of everything. And I also think that that's really can be a big plus for someone in early sobriety.
And we've seen that actually be the case, is that the natural surroundings do contribute to people seeing that life in recovery can be less chaotic and crazy. So that's helpful. So if someone were listening today, they wanted to access services at RiverMend Health, how could they get in touch with you?
I'm always happy to talk with anybody, and I can, provide you my phone number if needed. And I do think, though, that a really great thing to do to kind of get several things taken care of at one time, including the assessment, verification of benefits, and general program information, is to contact our intake department. And our National Director of Admissions, Kristen Scheel, is amazing and has put together a really, really good team with a lot of resources. So I always encourage people, even if you don't know if it's going to be a good fit or you don't think it will be, to just give a call anyway, because our rule of thumb with our intake group is to never hang up the phone without giving resources, whether they're with us or with another program. So I would say that anyone needing to get in touch with RiverMend Health can call our intake line at 844-464-3876, or always feel free to reach out to me as well. My email address is edubois@rivermendhealth.com.
Wonderful. Thank you so much for taking the time.
Thanks, Gina. It was my pleasure.